and depression. Okay? Very few muscles do one of those motions in isolation, so they're going to be moving in combination. So for upper trap, we might have elevation and retraction. Okay, lower trap will have depression and retraction. Okay? So we care a lot about what the scapula does because what it's happening back here really impacts the motion, the functional motion that we need at the glenohumeral joint. So you should, when you have a patient with a shoulder problem, spend a lot of time around the scapula. We're going to be using the spine of the scapula as a landmark when we do some palpation of the spine. So that's another reason why you might palpate the spine of the scapula. We're also going to use the borders of the scapula to find the glenoid fossa posteriorly as well. Okay, so being able to palpate the scapula is pretty important. In particular, for me, the levator scapulae that comes off the superior angle of the scapula is really oftentimes tight and sore in people with either shoulder or cervical problems, so that's an area that you really want to check. So I'm going to go ahead and get directly behind the inferior angle of the scapula, right? If I'm going to watch Jenna move, I can find the lateral borders and basically put the inferior angle of the scapula in the web space of my thumb and index finger. And go ahead and flex your shoulders all the way for me. All the way up to the top. Okay, come on back down. So here, I'm holding her scapulae and I can see if the motion is symmetrical from one side to the other. Okay? So we talked about medial border, inferior angle, lateral border, spine of the scapula. If you just put your hands on their shoulders, the spine of the scapula will jump out at you. Okay? So you can palpate that. Some of you were already using the spine of the scapula as a way to come out and find the acromion. Right? The spine of the scapula is going to divide the area into the supraspinous fossa and then the infraspinous fossa, right? So we're going to have the infraspinatus down here. Supraspinatus is up here, but what muscle attaches to the spine of the scapula? The trap, okay? So you're going to have to palpate through the upper trap. Now we've talked about, we're going to do muscles a little bit later. Are the fiber orientations of the upper trap and the supraspinatus the same?
No.
No. So one of the things we can do to try to differentiate those muscles is to palpate cross fiber. So if I want to, so what muscle is the most superficial? Trap. Okay. And so if I'm going to have my fingers, but my fingers are staying relatively parallel to the surface of her shoulder. If I want to palpate supraspinatus muscle belly, those are going this way, right? Fiber orientation. Now I'm going to increase my angle just a little bit. But it didn't change my pressure a whole lot, right? And now I'm going to go cross fiber. Okay? But my pressure's not that much different, but do you see how my hand position is different than it was before? Okay? So we have spine of the scapula, medial border, superior angle, inferior angle, lateral border, the infraspinous fossa, and the supraspinous fossa. Oh, the first rib, that's always a fan favorite. I think on the next slide I have some slides for you. Now remember, these are all, right? And I'm on both sides with her, but I'm not pressing super hard, right? Some of you are going to want to go, and the person you're working with is going to go, and no one's going to have a successful endeavor. Sitting is not the best position to palpate first rib because the muscles aren't relaxed. If you can't find it in sitting, we'll come back to it when we go supine. Okay? The reason palpating the first rib is so important, particularly in motor vehicle accidents, with the seat belt, depending on driver's side or passenger side, can actually push this down while there's trauma. And so the ribs can actually get stuck in a position that doesn't allow breathing. And so with inspiration or expiration, again, it depends on which way it's stuck, they'll have pain. And it's something that's really often overlooked. And if you find it and can treat that first rib, you will save the day. So it's really important to be able to find the first rib and to remember to look for the first rib, again, for people who are having headaches, neck pain, or shoulder pain. You're always going to want to check that first rib. Okay? All right, so let's go ahead and underneath the scapula. Okay, so this is where having short fingernails is going to be important. So what you're going to do is I'm going to slip under Amanda's shirt. Hopefully you can still see it. Are you comfortable with me doing that? Go ahead and relax your arm. So I've put my arm under her arm. Okay. I have my fingers of my right hand on the edge of her scapula. Okay. What I'm going to do is curl my fingers, and my fingernails are a little bit long. I'm sorry. I'm going to actually push her scapula over my fingers. Go ahead and relax. You did it for me. Okay, so I'm going to roll her over, and my fingernails are too long, so I don't want to do it. But I can get under there, and then I can feel the underside of the scapula. It's also, this is going to be a technique you're going to use to actually work on scapular mobility with the person. So you need to be able to practice rolling under. Now, some of you, thank you. Some of you are going to have developed enough back muscles that your partner is not going to be able to roll their scapula over. Okay? Don't keep trying, just get a better partner, okay? Because some of you, it's just not going to work, all right? Okay? So I'll just do it one more time. My arm is going under the arm that I'm going to test. I'll do it over the shirt this time. Relax your arm. I'll do it over the shirt this time. Do you see I'm already under her scapula a bit? I then can push her. See how far my fingers are disappearing? Okay, I can push her right over my fingers so that I can palpate the underside of her scapula. Okay, and now I've got her.
And this one's really important, that when these right hand, her fingers underneath the scapula aren't so pointy, and yeah, you want to really, again, that's where you just hold the position and let the soft tissue melt away versus sticking because it can be uncomfortable, especially if it's immobilized.
And that's why you really want to just put your hand there. When I'm here, I'm not digging under. I have my hand here, and then I'm pushing her over my fingers. Okay? Because muscles respond to trauma by contraction. So if you go in it, the muscles are going to respond by contracting, and you'll never get under the scapula. Okay? All right, so let's go ahead and try that, and then we'll take our tubercle, right where her index finger is. So what you're going to find is you're going to come up the lateral border, and all of a sudden the lateral border is going to roll out towards the humerus. That's the infraglenoid tubercle. You're going to palpate that because it's going to be very close to the glenohumeral joint, so if there's any kind of lack of integrity of the capsule, this is our posterior approach. Okay? Me, because of my dimensions, I palpate this structure crossbody. Okay? For some of you, that absolutely will not work. So you will need to palpate it on the same side. For me, it works much better to go across. So I'm going to go ahead and have you, do you have air coming through? There, is that better?
Yeah, there we go.
Okay. So we're coming up along the lateral border, and I'm looking for that flare back out towards the humerus. Okay, and that's going to be the infraglenoid tubercle. Okay, and it's right there on him. All right.
So do you have to go through like the teres minor?
Yeah. Well, it's going to be a little bit superior to that because those are going to be lower mid, right? So if you see the ridge on there, you're going to be just superior to that. But when you follow the lateral border out, you will. So anyone else who's over there want to come over and see this? Or are you feeling pretty confident? Sorry, Ben, for keeping that. Okay. It's going to be this direction, right? So I'm going to palpate cross fiber. Now, how about the muscles that are right there? Are they running the same orientation as the ligament? No, they're running this way, right? So if I'm strumming over something and I feel tension, I'm not in the muscle, I'm on the ligament. All right? Now, the corticoclavicular is shorter and it's much more vertical, okay? So I'm going to come in between there, and again, I'm going to go cross fiber. Okay, now, did you identify those? Did you cut down that far on the shoulder? I don't think so. So ligaments do not have